I'm here today to discuss a caregiver's role in navigating genetic testing. My name is Brooke Croak, and I'm a genetic counselor at Synapticure. I've been here for about 4 years, and pictured on the left is my father-in-law and my husband and a couple of my kids. Today, I'm looking forward to discussing with you all a variety of topics that all are encompassing the genetics of dementia and other neurodegenerative disorders and how a caregiver can help to navigate figuring out whether genetic testing is right for your family or family member. We will talk a little bit about the history of genetics in neurology. I'll go through the 5 W's of genetic counseling, who may seek genetic counseling, what genetic counseling is and what genetic testing is, when this service should be sought out, what is happening during an actual genetic counseling appointment, where you can get these services, and why you might want to consider these services. We'll talk briefly about how to guide family discussions for those that are interested in pursuing genetic counseling and/or testing. I'll also go over a few support resources, and at the end, we'll have some time for a live question and answer session. To begin with a little bit of history, I think it's very important to understand that we are really in the early stages of genetic testing in the realm of neurodegenerative disorders. Many of us have heard of the gentleman from Germany who was officially the person who Alzheimer's disease was named after. And really, in the United States, this term did not start being used until maybe the 1910s or 1915. Shortly thereafter, a specific other subtype of dementia, frontotemporal degeneration, was a term that was coined, and it wasn't until 1953 that DNA itself was discovered. So we have to understand for a lot of our family members who may have a diagnosis or history of dementia in your family, a lot of those were clinically based diagnoses and were not understanding the DNA-based nature or genetic nature of some of these conditions until much later and much more recently. I will review some of the genes that are associated with different types of neurodegenerative disorders, including different subtypes of dementia. But just to highlight when some of these genes were discovered, I will go through first some of the genes that are linked to early onset Alzheimer's disease, or EOAD. So in 1987, that's when the PSEN1 gene and the APP gene were first linked to autosomal dominant early onset Alzheimer's disease. In 1993, that's when another risk variant for a late onset form of Alzheimer's disease, or the ApoE gene, was specifically tied to an increased risk, but this is not a dominant type genetic factor like the first two that I mentioned. I'll talk a little more about how ApoE testing is used for management purposes for people who are considering moving forward with anti-amyloid therapy, but it is not a common gene that we use for risk information for family members. In the same year that ApoE was discovered, the MAPT gene was also linked to a subtype of dementia called frontotemporal dementia. And at the same time, for Huntington's disease, we discovered that gene. In 2003, another gene was identified to be linked to frontotemporal degeneration, the GRN gene. There are some trials surrounding that gene now today, and I think it's interesting to know that it took about 20 years for trials to begin for a gene that was discovered in 2003. Another gene called TAR-DBP was discovered that's also tied to FTD, but also ALS, and that was in 2008. And then one of the top causes of frontotemporal degeneration and also ALS in the European population was not discovered until 2011. So with those recent findings, you can understand why many family members who have a diagnosis of dementia may not have ever had genetic testing, because this is a fairly new area of discovery. And even if a gene was discovered, clinical testing may not have been available until many years later. It is fairly routine now that individuals with some types of neurodegenerative disorders, like ALS, are more routinely being standardly offered genetic testing as a first, post-diagnosis step in their management plan. We're not quite in that situation with all types of dementia, and I will review why that's the case. One argument is as more management and treatment options become available for genetic subtypes of dementia, that will prompt, a desire to move forward with testing. 2019 is sort of the most recent genetic counseling, incorporation of ApoE gene testing into clinical trials related to that anti-amyloid therapy. So again, being 2026, we're just starting to discuss genetic testing across the board for individuals with dementia. And there are definitely specific subtypes that it would make more sense to have these conversations surrounding. So just to give you a little bit of history, we've discovered a lot of genes, but we definitely have a lot of room to have more discoveries. For Alzheimer's disease itself, we expect that only a small percentage right now do we have a known genetic cause. Maybe 3% of individuals with Alzheimer's disease have a dominant genetic cause. And then moving on to something like frontotemporal dementia, probably only 10 to 15% of those individuals will have a known genetic cause. As always, if there's a family history, we expect there's a higher chance that there's something genetic in nature that can be identified through testing. Again, as more discoveries are made, it's possible these percentages will change, but we're just getting started in the field of neurology with genetic testing. So I'll first start by discussing who genetic counseling should be offered to or who may want to consider moving forward with genetic counseling. Oftentimes, individuals who will have different subtypes of dementia, as I mentioned, frontotemporal degeneration, which includes all of the subtypes listed below, behavioral variant FTD, semantic or non-fluent primary progressive aphasia, cortical basal syndrome, and PSP or progressive supranuclear palsy. Those are all considered types of frontotemporal degeneration, and those individuals, would maybe be eligible for sponsored or free genetic testing just based on their diagnosis. This would also be the case if there is a diagnosis of early onset Alzheimer's disease. Most clinics are considering that to be either under the age of 60 or sometimes under the age of 65. And then lastly, just anyone with a known family variant or a strong family history of dementia or any other neurodegenerative disorders such as ALS, Parkinson's disease, movement disorders, etc. This is just a small sampling of individuals who should consider genetic counseling. In the end, it's really up to an individual and their family as to whether they want to pursue the conversation about if genetic testing is right for you. So as a caregiver, just recognizing that a specific diagnosis or a specific family history can prompt eligibility for certain testing programs or research studies. It's important to understand that. And it never hurts to just have the conversation to see if your specific situation, it would make sense to proceed with genetic testing. And that's what the genetic counselors are for, to discuss and have that conversation specific to your family situation. So what actually is genetic counseling and what does it entail if you do choose to schedule an appointment with the genetic counselor? First, I want to mention that anyone in the family can participate in genetic counseling. We are fortunate that COVID created a situation where many of these types of appointments are available virtually through a Zoom meeting, and that allows multiple family members from even across the country to participate. Ideally, we are going to schedule an appointment with a specific family member. That can be a caregiver, that can be a diagnosed individual, or it can be a group or a family that's interested in discussing these things all together on one appointment. In those sessions, what we typically do is start out by talking with the family about goals and what they're hoping to get from the discussion. We definitely review a 3-generation pedigree or family history, where we ask questions about other types of dementia in the family, any movement disorders, psychiatric disease, etc., and try to get a better picture of what type of testing might make sense for a family based on that history. Once we've had a chance to review the family history and the family goals, we usually talk about different types of testing options. And again, this doesn't mean that you have to proceed with testing right away. What it would mean is that you would just need to have a discussion and then have your opportunity for testing reviewed and basically understand what the options are for you and your family members. Once we have that discussion, there would be information given on who the most appropriate person in a family would be to test, whether that is a living relative that has a diagnosis, or potentially we're able to get a sample from a deceased family member and perform testing. We would review those options. And we would also review whether any legal paperwork may be required to proceed with testing. For instance, if you are a caregiver and have healthcare power of attorney, we may require that paperwork if you were interested in moving forward with genetic testing for your loved one and help provide consent for that. If testing has already been completed prior to your visit, some patients do come to us with a prior history of testing and they want to just have a discussion surrounding their genetic testing results. Then we could have more discussion specific to risk assessment for family members. Otherwise, if you wait to proceed with testing, once those results are back, eventually we can definitely go through risk assessment with your family as well. Another piece of the conversation is typically regarding support for both you as a caregiver and for your family members. There are so many great online support groups and advocacy groups, depending on the specific genetic subtype in a family or family history, that we are happy to connect you with. We can also connect you with researchers that may be specific to your situation, and that oftentimes can open doors for maybe additional testing as a family. And then lastly, if we have information that we know there is a specific genetic cause of a diagnosis in your family, we can talk about gene-specific therapy or trial options. Of course, the genetic counselor would not be working to manage any type of therapies, but we could provide information on what might be available so that you could then speak with your neurologist about those options. The chart here is from a clinical kind of consensus guideline on ALS genetic testing and counseling from 2023. However, it does apply to any type of neurodegenerative disorder, typically in terms of the questions that are asked and the risk assessments that are usually provided. So when should a family member or an individual who has a diagnosis or a caregiver seek genetic counseling? I would argue that anytime you are ready to start a discussion on that, ideally, as soon as an individual is diagnosed, they would have the opportunity to access genetic counseling if that's something they desire. And it never hurts to have a conversation. It does not, again, mean you have to proceed with testing immediately, but at least you can become aware of the options related to your diagnosis, and how that might affect a management plan. It's helpful to have that conversation even in the beginning stages of a diagnosis. Again, testing can be, proceeded with later in a diagnosis, or we can proceed with testing for unaffected family members, but the ideal situation is to work with an individual who has a diagnosis first in a family if that's possible. So we are here anytime you are ready. We spoke a little to this, but basically genetic counseling itself, there are ways that you can seek referral to an in-person genetic counselor, but fortunately at Synapticure, there is an option that you can have a telehealth visit with one of our genetic counselors. We are licensed across the United States, so it does not, require for you to be in a specific state as long as you just tell us which state you're located in, we can confirm licensure. We are happy to see you. And it does again provide the opportunity for multiple people to join a Zoom call together if there are other family members, caregivers, etc., that would like to join that call and have the information. On the left here is a picture of some of the clinical testing kits. You might be wondering, how would you get genetic counseling or genetic testing if you have a Zoom call? And fortunately, we're able to ship a testing kit directly to your home if you do decide to proceed with testing. So it's pretty straightforward. We schedule a Zoom call with you if you're interested in having the preliminary conversation about testing options. Anyone can join, and following that consultation, we would either develop a plan for testing or just stay in touch. Maybe there are more workups being completed, maybe MRIs, other imaging. And if that's the case, we can always wait and compile all of the medical information that would be necessary to making the best decision for testing. So we are happy to meet with you virtually and discuss those options. An individual may seek genetic counseling for a variety of reasons. We've already reviewed that counseling itself does not equal testing. It really is just meant to start a family conversation. Some people come to us and they are already adamant and know that they want to proceed with testing, and others just want the information, and maybe we'll take some time after our discussion to talk with other family members, make sure that everyone is on the same page, and then proceed with testing after they've had a chance to do that. One piece that we usually like to inform individuals of is sort of what costs there are associated with genetic testing. Fortunately, in this realm, there are a lot of what we call sponsored tests. So if an individual has a diagnosis that, is eligible for sponsored testing, we would definitely review those options. Sponsored just means that typically a pharmaceutical company is paying for your testing because they are hoping to learn more about the genetics of your specific diagnosis. So it's also helpful to meet with a genetic counselor because they may be aware of some of these free or sponsored clinical testing and or research options that you might not have access to otherwise. We also discuss who in the family might be the best person to test, and again, trial options, etc. One reason I would encourage everyone to consider genetic counseling is that it is a dedicated time to talk about genetic testing options and how that can affect your management plan, and just risk assessment for other family members. There are plenty of neurologists who, definitely have the ability to order testing, but there's not always enough time to focus on the genetic counseling aspect of it in a regular neurology appointment because you may be discussing management in general or other orders required. And oftentimes genetic counseling sessions are between 30 and 60 minutes, focused specifically on genetics. So it's nice to have one meeting that's just dedicated to this realm. Again, the conversation may just help you better understand the risk associated with your family history and management options, and this might be beneficial not only for the person diagnosed, but also for their family members down the line. So I am going to briefly go over what to talk about during a session, just so you can have a better understanding of the different types of genetic testing that are available. The first one is testing that would be ordered by a provider, such as a genetic counselor or a neurologist. This is called clinical testing. And typically, we target testing to a specific diagnosis or a specific family health history. Clinical testing is something that requires a sample to be sent to a laboratory. There are a variety of different genetic testing laboratories across the country. Luckily, again, we're able to send a testing kit like those pictured on the right that are typically saliva sample or buccal or cheek swabs that you are able to perform at home. You do have to write your name and date of birth and the date that you collect the sample, but you just place it back into the box that it came in, and there is even the clinical packaging and shipment label that's required to send it back to the laboratory. So it's a simple process. We can coordinate blood draws locally if needed, but many times a saliva sample is sufficient for the type of testing that we're ordering, and it's very stable, so we don't have to worry about timeline or sending the kit right away. If you just collect the sample in the morning, it's okay if you take a day or two to send it back to the laboratory. The other type of testing that you may have heard of are things like 23andMe, any type of direct-to-consumer testing, which means you specifically are ordering the test yourself and paying a fee online, and there's no provider directly involved. Many people come to us and they maybe have had direct-to-consumer testing completed, but there is an advantage to having actual clinical testing, for instance. Clinical testing itself, usually the reports that are provided are something that if you were wanting to proceed with a clinical trial, we would need a clinical testing report and not a direct-to-consumer testing report to be eligible for certain gene-specific trials. So there is an advantage. And also just the difference of sort of reporting for direct-to-consumer testing versus clinical testing is that your neurologist will more likely be able to use the information provided in the reports from the clinical testing, whereas direct-to-consumer testing oftentimes is a little more difficult to interpret by a provider because it's not meant to necessarily be part of your medical record. It may not review as much risk information or be as straightforward. But they do have, ways to basically, we can work with you if you've had direct-to-consumer testing and determine if there is some need for clinical testing based on results of direct-to-consumer testing. But most often I would recommend that even before doing any type of direct-to-consumer testing, meet with a genetic counselor because they may find that you're eligible for a type of clinical testing that will be of no cost, whereas direct-to-consumer testing usually is of cost. The next type of testing that we will review with you if it's relevant is research testing. This type of testing can sometimes be done through a university setting, or it may be also through a clinical testing company that's offering research testing, and some type of collaboration between the two. Usually research testing does take longer, so you may enroll in a study and you sometimes may not get results for 6 months to a year. So it's, depending on what your desires are, if you were to want to be involved in a clinical trial, clinical testing is the way to go. But research testing benefits society as a whole. That's how we learn about the genetics of different types of disorders. And some people just choose to participate in research testing because of that, and they would like to do as much as they can to learn about the particular condition in their family or that they've been diagnosed with. Lastly, we can talk about DNA banking. This is an option for families who aren't quite sure yet of what type of testing they want to proceed with, or maybe they have a family member with a diagnosis and we aren't sure, or sorry, an undiagnosed condition where we aren't sure what is going on, but we know it might be in the neurodegenerative realm. We always can offer the option to bank DNA, meaning send a sample in, have the lab extract the DNA, and save it for testing for the future. Options have become a little more limited in terms of ability to do this at a low rate, but we are happy to try to work with you to see what DNA banking options might be accessible to you. So in general, we have reviewed some of the types of dementia in the first screen when we talked about history, but this is just a good overview of some of the genes that are currently available for different genetic subtypes. I'm not going to go through all of them today, but this slide hopefully highlights the complexity of testing in the realm of dementia. It really is determined, which route we go based on your diagnosis or what clinical workup you've had to date. It's very helpful if you can to come to an appointment with your clinical history. So maybe, have you had an MRI? Have you had a DAT scan? Have you had any other clinical workup that would help indicate what the best route to go is in terms of testing? For some families, we start with a small panel based on a specific diagnosis. However, if there's a family history that tells us otherwise and that there may be something else going on, we can also consider looking more broadly outside of just an individual's diagnosis, but maybe what the family history picture points to. So here's again just an example of all the different types of genes that currently can be tested for, just a subset listed here. And just knowing that as we discover more over time, there may be additional options available. So we would talk specifically to your diagnosis or your family history and come up with a plan. I've highlighted a little bit just that early onset Alzheimer's, while we do know that it can look highly genetic in certain families, we only understand the genetics of about 2 to 3% of individuals with early onset Alzheimer's. And of those families, the top three genes are listed here on the top, the PSEN1, PSEN2, and APP genes. ApoE again is a risk factor for late onset Alzheimer's disease, and it is more often used right now to determine if there's a risk associated with anti-amyloid therapy. So that may be another reason why people would pursue that type of genetic testing. This is just an example of the sponsored testing or free of charge testing that can be available for a subtype of dementia, in this case, FTD. Things are changing over time, so this program is available, but you do have to meet with a genetic counselor through the sponsored testing program to be eligible and to move forward. You do have to have a diagnosis. This is not an opportunity that's available for individuals who have a family history of FTD. You have to have an actual diagnosis of FTD, but there's a subset of genes that they will look at. And again, this is a free of charge option that we can point you towards if that's something you'd be interested in. These same genes can be looked at through other testing labs as well, and billed through insurance. So even if you're not eligible for a testing program like this, we can still look at insurance costs and determine if there's another option that would make sense for you or a family member. We aren't focusing today on movement disorders, but I do want to mention that there is a lot of overlap between different types of neurodegenerative disorders, whether that's ALS, Parkinson's disease, or any type of dementia. And there are some individuals who might have a dual diagnosis. For instance, Parkinson's disease that led to dementia or dementia that led to Parkinson's disease. One other option for research studies are that there are opportunities through things like the Michael J. Fox Foundation. Here, PD Generation is a study that looks at 7 genes for individuals who do have a diagnosis of Parkinson's disease. Again, research testing does take a little bit longer than clinical testing, but it is a free research study. Again, you would have to do an intake with a genetic counselor via Zoom and choose to enroll in that study. But these are also opportunities we can discuss with you during genetic counseling visits. In terms of trials, there are definitely opportunities for conversations regarding specific trials, especially if you get a positive genetic testing result. In terms of FTD, there are quite a few trials that are ongoing. Some have closed, some are in phase 1 and 2. We are hoping that this list continues to grow, but just know that depending on the gene in a family that's identified, there may be a specific trial that you or family members could be eligible for. One specifically that is for individuals with 2 different genetic subtypes of FTD, the GRN gene or the C9orf72 gene. These are genes that are the more common causes of genetic FTD. And I just listed some of the criteria here, locations that these clinical trials are available for. And, basically this is information we would be able to review with you if we did get to a point where we had a gene-specific answer for your family or family history. In terms of being a caregiver, it's important to know that there are some conversations that can be helpful to have before you even schedule a genetic counseling visit. For instance, has anyone in your family had genetic testing? Has anyone had an autopsy? Do we have results from family members who are affected that we could use and bring to the genetic counseling appointment? Or is this a sporadic case and you're still interested in learning more about whether your family member could have a genetic subtype of disease? Next is sort of understanding that genetic testing itself is a family affair. So if you or a family member do choose to proceed with testing, results can affect family members. And just feeling comfortable with, you know, do your family members have an interest in having that information? It's helpful to know that before you proceed with testing. Maybe you have children and they are adult children, but they are not interested in having this conversation. How would you navigate that once you had a positive result? How would you navigate that when you have a negative result? Those are all conversations that are complicated and family specific, but we do encourage you to think about that aspect of genetic testing and know that a genetic counselor can walk you through some of those conversations as well. So again, if you get to a point where you as a family or you as an individual feel like you're ready to move forward with testing, there are some pieces of information that can help guide testing, and it may be that you would want to gather these pieces of information before you meet with a genetic counselor. Again, any autopsy results, imaging or other clinical studies, and biomarker testing. In terms of support, there are a lot of wonderful resources available online. These are just a small sampling of some of the resources that are a little more specific to um, FTD. The Association for Frontotemporal Degeneration is great. They have an annual conference, and that is coming up at the end of this month. They do offer a virtual option, so that is really wonderful to learn more about that type of a diagnosis and just learn more about research that's happening in that area. Next is In the Legacy. They are a group that is surrounding the genetic forms of ALS and FTD. Within that group, there are even just some different genetic specific types that of individuals who have a specific gene in their family. And there are some nice resources on their website specific to types of FTD or ALS. So a C9ORF72 kind of family information book is available. There are downloadable PDFs of those resources. And they also offer support, peer support groups, and all kinds of information. They also have guidelines for pre-symptomatic individuals that's posted on their website. The last two on the left are a couple of examples of gene-specific FTD advocacy or support groups. The MAPT gene and the VCP gene both have groups of individuals who are focused on research in the area of their gene. And so if you did have a positive result or had a family history of one of these particular gene subtypes, we can also, link you up to groups like this that might be relevant. In general, there are more supports that we can offer. There are many online, monthly groups that meet to discuss specific diagnoses. And so this is just a small subset of them, but we would be happy to help provide resources specific to your situation. Some of the groups have sessions that are even meant just for caregivers, and others are meant for individuals that are diagnosed. So again, depending on your family situation, we can help connect you with the right resource. In addition to providing those types of online support groups, we do have some fact sheets that are available through Synapticure, specific to genes and just information that may be helpful to you. We also are able to create a gene-specific letter to be shared with extended family, or just a letter that explains process of genetic testing. In addition to that, we are able to connect you with other researchers. And that can be relevant in situations where maybe we have a strong family history of a diagnosis, but no known genetic cause. That's how we get answers, and that's, how we get to the point of being able to offer clinical testing, is that a researcher studies a family and discovers a gene that becomes relevant for other people with that diagnosis across the world. So these are just some examples of how we can help you as genetic counselors. Lastly, I'm just going to review a little bit about guidance surrounding genetic testing. There's not a lot in this area, but over time, I'm expecting that we'll see more in terms of specific guidance for who should have genetic testing for individuals with neurodegenerative disorders. One of the first guidelines that came out was in 2011 regarding genetic counseling and testing for Alzheimer's disease. And there hasn't been a major update to this joint guideline, but it's good to know that it does exist. And it really focuses only on those 3 genes I mentioned for early onset Alzheimer's disease and a little bit about ApoE. One of the more kind of relevant, I would say, not clinical guidelines, but just a viewpoint on who should be offered genetic counseling and testing is specific to FTD. And in this, there is a nice statement that says, the time is now to routinely incorporate genetics into the diagnosis and management of individuals with FTD to create an informed, empowered, and trial and treatment-ready population. I think this is a great statement, and it just highlights that there is a need to provide education surrounding the option of genetic counseling and testing, particularly within the FTD community. Here are some of my references. And I do want to leave a little bit of time for questions and answers. If I don't get to your question today and you would like to reach out, please don't hesitate to do that. My email is here as well as my other contact information. Thank you again so much for going through this with me today, and I'm happy to start by answering questions.